We are live, definitely on LinkedIn. I'm going to try this again. We are live.
Hello.
Hello. Welcome, everyone. We are here today to talk about some fun topics. Marina's here with me. Thank you for we are going to talk about integrative solutions for IBD and IBS. I think it's an extremely important topic to discuss. Many people still don't know the difference. Many people would like to understand where they could concentrate on. And I do want to welcome everyone to this masterclass. It's a jam-packed, information-packed, and resolutions packed masterclass. So welcome, everyone. I think I'd love to have Marina introduce herself too, and then we're both going to discuss both topics. We're going to have the difference, the common things of IBD and IBS, and what we can do today already to address a lot of these issues, whether you are currently a practitioner helping your clients with these conditions and you're a coach, or you're a patient yourself and you want to help yourself. Tell us about it.
Absolutely. Yes. Welcome, everybody. Again, just to echo Dr. Ina, we're so excited to share our experience and our knowledge about this very important area that I think is just so common, unfortunately, and people think it's normal. And just to address some logistical things, there were a couple of people who emailed me about not being able to register. So I sent you the direct link. And we are streaming it also to LinkedIn. So hopefully everybody can find us and follow along. And if not, just feel free to email me or message me and I will send you the replay. And everybody who is joining us on Zoom, just please have yourself on mute, but we will have a Q&A at the end so you can show us your beautiful faces. And I'm also going to be keeping an eye on the chat as well.
Perfect. So I'm going to take it from here. And again, whether it's you, someone who's had this condition for a really long time, or it took a really long time for you to get diagnosed, or maybe you're not even diagnosed, you're still having symptoms and lab results look normal, which we find very commonly today with Hashimoto's patient, thyroid, even with colitis, people are undiagnosed for a while until they're really, really broken. So if you're annoyed and you're having fevers and you have these runs, you have this pain and fatigue and still unclear on your next direction, or if you were like me and had the condition and tried medications, for example, like myself, and the medications got me worse. So I'd love for you to listen in, and if we'd love to help you and make this as clear as possible, especially if you can't work, for example, like women today, men, we need to get out and enjoy and put in the time at the workspace, and we have to be there, present, focused. And if it's not possible with the health condition, we are not in a good place. So if this sounds similar, 31-year-old with diagnosed Crohn's, and she realizes that it's no longer the life that she's looking forward to. She's not that optimistic girl she used to be. She can't be doing these morning walks because she's exhausted from the medications. She's embarrassed to have the sex life she used to have with her husband, and that is something many people do not discuss or don't talk about with chronic illness. People's sex drive is low, people's sex life suffers. It's a huge issue, and many doctors don't even like to discuss that. And what has become your normal? Are you tired, moody, depressed, and like this is becoming your normal? And you're just ready to, like, what is out there? What can help me? I can't live like this anymore. So this is definitely for you. And let's talk about what we can do and before something else is offered in the traditional medicine pipeline, and the next fad diet or the guru that suggested this and that and nothing still worked. Not a quick fix maybe, but something that's proven to work. And again, I'm going to introduce myself. I am a pharmacist since '97. I'm a 2 times best-selling author. I have created Crohn's and colitis solutions program that I've been working with clients for close to 15 years on this particular program. I have started training other healthcare practitioners as well in functional medicine and in coaching, because I've seen it work over and over for myself, for my family, friends, and then I started working with clients. I had my stressful job, and first I was misdiagnosed myself, and it was no life with the medications that made me feel terrible. I've tried different methods. I've tried so many different things. Went for spiritual cleansing, spiritual journey to Brazil. I went for acupuncture, acupressure, breathing techniques, different types of complementary medicine until I found functional medicine. That was something that really turned the corner for me. I felt like myself again. It took time. It took time to get so much better from the point where I started, but that was my turning point. And I would love to hear Marina's story at this point and for you to be introduced to her practice as well.
Yes, thank you so much. And this is exactly why Dr. Nina and I are so excited and passionate about partnering up to showcase this webinar for you, because we both have personal experience and also with clients. So for me, I am a PharmD. I graduated about 10 years ago. And from there, I became a health and mental fitness coach and a clinical herbalist, among some other certifications. And I'm part of a team of functional medicine pharmacists, actually, via Farm to Table, and I'm a host of the Holistic Pharmacy podcast. I also co-authored a couple of books, and I created the Build Your Holistic Herbal Practice Mentorship Program for other healthcare professionals to establish their own profitable and integrative medicine businesses. So I do focus on herbalism, and I think you'll see that during this talk, but it's really just about understanding that we have options and choices. And so if you are not happy with whatever proposal you have from your doctors and you're getting your second and third opinions, this is something to consider, all these different ways to come at the same problem. I'm also a wife and mom of 2 kids and 2 cats. And I also call myself a plant mama as well. So,
Tell
yeah,
me,
so
plant mama because of the holistic practice of the
yes,
herbal practice. I love that.
yeah. So my husband jokes, but that sometimes the plants die, but I'm getting better and better with the plants.
Yeah.
With my green thumb.
Oh, I love it. And it's all about energy too. And again, in my practice, I discuss the importance of that as well. De-stressing, energetic fields and all that. All
Yes.
right.
So next slide, I'm actually sharing about my journey. So I also got diagnosed a lot. Even as a child, I had digestive issues and disorders. And I had things like just stomach upset and cramps all the time and motion sickness. And then at 15 years old, I was diagnosed with IBS, which is irritable bowel syndrome. And it's sort of the diagnosis of exclusion when nothing else they can pin on you. And then GERD, so gastroesophageal reflux disease, and H. pylori at 20 years when I was in college. And then when I was graduating, I was diagnosed with dacryostenosis, and that's a narrow tear duct situation that was very strange. Then acne and PCOS at 24 years, and then SIBO, small intestinal bowel overgrowth, at 25 years. This is just some of my diagnoses. And I also tried a lot of different interventions, anything from energy healing and homeopathy on that spectrum to herbs and drugs and functional medicine and different diagnostics from different levels of invasiveness, including surgical procedures. And unfortunately, you know, I did try the Western route first in my case, and that's why I had to kind of go and see other options, because not only was it not working, a lot of times it was also harmful. So I wanted to avoid the side effects that comes with that. So next slide, please. So our learning objective today is to learn about functional options for digestive problems. And we're going to learn more options to decrease the inflammation with the help of functional medicine, functional diagnostics, nutrition, nutraceuticals, stress reduction, and herbs. So let's dive right in. So what is IBD? As we mentioned, it's inflammatory bowel disease. What does this mean? There's a chronic grade inflammation going on along the whole gastrointestinal tract. So there's Crohn's disease and there's ulcerative colitis, and it's just a matter of how much of the bowel is affected and how spread out it is. So you can see symptoms like rectal bleeding, diarrhea, fatigue, and weight loss with IBD. Now let's get into IBS. That is irritable bowel syndrome. So this is more like a group of symptoms. Again, we are not really sure what the root cause is, so we just named it for the symptoms that people experience. But the idea is that our contents of the digestive tract is either moving too fast or too slow. That's why you end up with symptoms of either diarrhea or constipation. And sometimes it goes from one end to the other. And some people tend to have more of one symptom or more of the other. And so there's also things like abdominal pain, cramping, and bloating. And this is something that I felt as well when I was diagnosed. And there's sometimes combination of acid reflux and food sensitivity that can go along with this diagnosis. So what are the causes? Again, so IBD, what we know is that there is an autoimmune and a genetic component to this disease, which is what's driving the level of inflammation that we're seeing. And the nice mucus lining that's lining your tract that's supposed to keep everything safe and not inflamed is constantly being eroded and attacked. And that's what's giving us the symptoms in IBD. Now, with IBS, again, it's less clear, but we don't see the same, autoimmune and genetic components. More like we just see a bunch of factors that can lead to symptoms of IBS. So we can think about maldigestion or digestive intolerance or food sensitivities, any kind of dysmotility, again, so the speed at which things move through. Even anatomical blockages could also lead to these symptoms. So we definitely want to make sure we're looking for those as well. Dysbiosis, so your microbiome, which is your flora, all the different microbiotic, either bacteria or yeast that lives in your lower colon and your digestive tract needs to be diverse. And so when it's out of balance or when it's in the wrong place, when it's not contained to the colon and it goes into the small intestine, it could also lead to symptoms of IBS. Estrogen dominant conditions can also lead to symptoms of IBS, and stress is such a big one that we're going to talk about it a lot later. So I pulled up this chart. So it shows us that the symptoms really do overlap. So it could be a chronic disorder. They could have the abdominal pain, change in stool characteristics, quality of life impairment. And they're both, unfortunately, considered manageable but not curable. But when we'll talk to you today, you'll see that there are long-lasting solutions. So again, with IBD, we are more concerned because there's a lot of the weight loss potential, and there could be a need for more intense screening and also medications in some cases. And you might want to do endoscopies and things like that and monitor the progression of the disease. Whereas with IBS, it's really just a functional sort of disorder, and it is more common. So let's get into how we would approach these. So before we see what's kind of off with them, let's look at the foundation of gut health in general. So this is very important when we talk about any autoimmune disease, because we will see that the gut and our immune system are closely related. So even on this picture, we can see, so the top one shows our barrier between the lining of the intestine and the cells that are kind of taking in food particles, and then they're putting them into the bloodstream on the bottom, which is where your immune system is located in your blood. Now, normally these cells are producing protective substances like the mucus lining I mentioned. So they create something called mucins, and they also have the bacterial layer as well to keep things diverse and digest certain things and help us absorb vitamins. And so it looks nice and healthy. But the problem is it needs to be very tight together, because these cells are only one cell thick, the lining that's forming between your intestine and your blood. So we really want to make sure it is very tight, and only the things that are supposed to be coming through those little microvilli that you're seeing, like a little, like those carpets that have the little projections, and they create this very high surface area for absorption, but we still need them to be optimally tight together so that they're taking in the things that we only need to be taken in. So now the problem occurs when in the next slide, we see the difference between the healthy lining, which is on the left, where you see there's a very nice, neat curve, and there's a strong mucosal barrier that you see in the darker blue, and nothing is penetrating into the blood that shouldn't be there. It's just the micronutrients that we're absorbing from the food. Whereas in the leaky gut situation that you see over on the right, you see that there's a disturbance, and these cells, the goblet cells that have the little projections in the villi, they are starting to break apart. They have more space in between them, and now bigger molecules can pass through. And when things like lipopolysaccharide, which is a component of the cell membrane of certain bacteria, of gram-negative bacteria, they come in, and other things like gluten, for example, and other proteins that we normally shouldn't be sensitive to, it all of a sudden creates this inflammatory response by your immune system. And that's when all the symptoms that we're talking about come up. So the number one thing that I want to bring to your attention is it always starts at the top. And what I mean by that is when we are digesting food, we need to be thinking about where digestion actually starts before we even get to that intestine where all of this inflammation is happening. So we need to look at the top level of why this digestive process is beginning to dysfunction. And the biggest thing that I think is the hardest for us to understand is that our lifestyle is at the root of most of these things. So the way that we don't adequately prepare to take food is one of the biggest culprits, in my opinion, in my practice. So people are running around and they're just stuffing things down, whether it's fast food or not fast food. The part about not sitting down and not being able to actually appreciate and enjoy and chew your meal is one of the biggest things that contributes to our inability to have a healthy digestion downstream. So we have two nervous systems, well, two sides of our nervous system, rather, that control how we process things like digestion. And in order for us to have the proper interaction with our food and everything to be as it should, we need to be activating what's called the parasympathetic part of the nervous system, so that it can start activating each phase of digestion and turning each phase on optimally. And one of the biggest nerves that's in our body, it's cranial nerve 10, and it spans the length of our body and activates our digestive system, is called the vagus nerve. So we need to be turning this nerve on to properly activate all these phases. And again, this would start at the top. So when you are preparing food, when you're smelling the food, when you're seeing the food, when you're getting ready to interact with this food is a very important step that's normally missed in our culture when we're just driving or running around and trying to stuff things down. So as you can see here, it really starts in the brain. So they didn't label it here, but I think it starts in the brain and in the nose and in you seeing the food. So those are all those cranial nerves, including the vagus nerve. And then you start to ingest the food. So your saliva starts to be secreted so that you can already start pre-digesting things in the mouth. And then you're mechanically chewing things that would then get down into the stomach. The stomach would then create churning mechanically again and also start secreting enzymes like pepsin that would start digesting the food. And that starts the process of chemical digestion. So next would be the small intestine, where again, you would start additional processing with enzymes and bile that comes in after the stomach. And each of these things also operate at optimal pH levels, which is also very important. So we're keeping the integrity of everything, again, by slowing down, by chewing, and by activating every phase at its proper pH. So then it can be absorbed properly, and then the right things would be down in the gut, and the right microbes would be there, and then you would have a normal stool, and you would have proper nutrient absorption. So again, this very important connection, your brain is super linked into your gut because of this innervation between the nervous system and the vagus nerve that goes and controls the things that are happening in the gut and slowing things down appropriately, and also influencing our microbiome, and the neurotransmitters that are made in the gut are influencing the brain. So everything is a two-way street here, and we need to be supporting both of these axes.
Thank you.
So now Dr. Ina is going to talk about stress.
Sounds good. I'm just going to get to one quick, it's not a modification, but it was really interesting for me to watch how the guidelines, again, I started this journey a long time ago, and I'm in the pharmacy field since the early 90s. We've seen Crohn's being in the realm of autoimmune, which you mentioned. If you look at the current guidelines, at the current literature with Crohn's disease, colitis, IBD as an umbrella in general, you're no longer going to find the word autoimmune. We now see that IBD is under the umbrella of immune system disease. Something has happened to the immune system that affected and caused on the genetic level, to whether it was the environmental factors or other things that actually put that, started that process of immune system breakdown. So what the difference between autoimmune and immune system, we still have that differentiation where autoimmune is there is a trigger, something's going on with the leaky gut, or in the traditional terms, it's intestinal permeability, which again, at some point, I was discussing this topic maybe 15, 20 years ago with gastroenterologists, doctors, board certified, and I would mention a term as leaky gut, and they were like, there's no such thing. There is no such thing. I'm like, well, what? Okay, you're familiar with intestinal permeability? Sure. I'm like, all right, that's the same thing. So, yeah, things, doctors are more open, doctors are listening in. Probiotics are no longer the secret that or the fight that I had to go through with my gastroenterologist at the time and prove my point. My doctorate degree was on probiotics as the point that I had to prove. And it's all back to the basics, back to the beginning. How does it all start? Taking a great history of your client, your patient is important. If you are the patient yourself, really getting someone to listen to your story and have that aha moment is extremely important. And that's where we discuss stress. Stress is not just the stress we think of, like generally someone yelled at us at work and we're under stress, or we are under stress with kids. We can't get things done. It could be a combination of things. It could be one single thing that can be a stressor for you, between physical, the chemical stress, emotional factors, environmental factors. It could be one thing that triggers you physically or emotionally, or it could be multiple stressors. The problem becomes when those stressors don't go away. We're not meant to be under a prolonged time under stress. We're meant to have a little stress and relax for a period of time. So we passed 100 years on this planet, especially in this country, work, created that constant adrenal response, and adrenal glands simply were not prepared for this phenomenon. And even emotional stress, when you fear and worry, that keeps you in constant fight and flight. That's no way to live. Addressing it, whether it's a therapist or your own tools in the box that you use for calming down, it all matters, and it all prevents a major disease if you think about this as a basic. There could be stressors as food allergens. If you're constantly eating the food that you're not aware of today, that you have a sensitivity to or allergy to, there are different types of reactions. There's an IgG reaction, like an inflammatory reaction. There's an IgE, like an allergy type reaction. IgA reaction, we really need to be on top of what's going on with foods if you happen to have a leaky gut, because more chances are, if you're having a leaky gut, you're having some kind of food sensitivities, because that's what happens next. Your body thinks, because these foods seeping into your abdominal cavity, they will create that type of reaction. So these could be a major stressors. Environment, that's a whole different, we could have a topic with Marina probably for hours to discuss environmental toxins, medications, and what they can do on the body and what stressors they are. And between having a stressful job that I mentioned, things that going on maybe in the family, we have stressors, the causes of major stress that can be something that we look at a year later and number them. This is an event that caused a tremendous stress in the body. We actually have them numbered, and divorce, moving, fire in the house are all somewhere on top. And if they're not addressed as stress events, and there was no help from whether therapy or some kind of group or great family support, and it constantly in the back of your mind was a stress for you, it's inevitable that it causes the disease in the end, some kind of disease it could be for you. And you could address it with other breathing techniques. I love EFT. I have a lot of clients that I recommend those for. Meditations are wonderful options. If you don't know how to meditate, consider trying. I highly recommend it. And I think that even though stress is becoming the new normal, even though it's like, well, that's the life today. Yeah, we had the COVID, we had a lot of things happen in the past decade. We came out okay. So can we change that narrative that stress is the new normal? Stress is what you want it to be. If you'd like to, some people say that stress, I can't perform well at work if I'm not a little stressed. Okay, but can you manage it? Do you feel that this is the way that you have your work, and then you're done, and then you come home and you fully relaxed, and you have that time where you're completely unplugged? we really need that time. Otherwise, again, adrenals will be affecting your inflammation. So I highly recommend adrenal testing for those that think that they've been on a stressful, prolonged period of time, and that could be more than just one root cause of the stress. We want to talk about detox again when we try to heal, because yes, we're now addressing the stress, we understand, we manage it, we do whatever we have to do, we test for adrenal hormone output, we modulate it, we take a really good care of our adrenals. Next, still not 100%. What else could be an issue? Eliminating, detoxing. If over the years you have tried all these medications, or you've been around toxins, and that process, and you haven't cleared out of your system, or the mold, I have clients, or Lyme, they're different, from pathogens to toxins to heavy metals to parasites that you could have that will constantly become, again, stressors for you. And if you do not get rid of it, if you do not detox it out of your system, it's very hard to seek full and complete healing. And we're not looking for the word cure, because we can't even use that word, right, in our coaching realm. But healing is definitely achievable if you address these main like basics, detoxification, adrenal health. And yes, our world, it's sad. And I teach my client, I have a whole module for my clients and my students that we discuss what toxins are, how to eliminate it. And I teach them we cannot sit and cry that the world is this bad and feel hopeless, helpless. This is what I can do today. I can improve my detoxification process. I can test myself. I can help my liver perform better and my gallbladder to push out thinner bile, so my digestive process is better and my elimination is better. So working on a detoxification process, especially now we're in April, this is when the body really wants the most of this. The body's screaming, I need detox naturally, right? We have springtime to wake up the digestive process again. So with my clients, I often have a split for those who completed my program, and then we go for specifically detoxification program for 30 days during the month of March or April. And it works really well. Good detox program with testing is even better when you know exactly what you need to clear out and eliminate. The detox has that, I'm not sure if it's used ethically lately. Lots of people use it for great marketing, and it sells products. You have to be a little more careful when you think about detox. I've seen people that go through crazy detoxes and using products that they were not prepared for. For example, I'm going to tell you an example of someone that used something that really was pulling heavy metals, and it was a great product to pull heavy metals, except they didn't have good elimination, not enough bowel movements to be able to clear it. Their liver was sluggish, so they felt sicker. It didn't help them. So again, working with the right practitioner makes the world of a difference. Eating right, anti-inflammatory, taking the right supplements that are mild enough yet effective for you is a major key, and understanding that for some they need a little heavier dose of detoxification, but we need to make sure you're ready, and the diagnostics showing that you're ready. Very important to figure out the right time for it. I'm a big fan of functional diagnostics. I was able to resolve a lot of cases figuring out just one single pathogen that was the culprit. So, and it doesn't have to be the pathogen. It sometimes was or it could be the micronutrient deficiency, depletion of something. And we often seen it with medications. And again, that's another big room for pharmacists to be helpful to our patients today that are taking medications that known to have micronutrient depletion, and who is discussing that with them. I mean, we've seen like what potassium is given with certain ACE inhibitors. What else? Not much. Not much else is there where we look at the patient profile and see, okay, this is the drug or this is the drug, and it causes this and this micronutrient depletion. Why don't we double check? Let's check and know for sure, and let's supplement them. Because now, without the Bs, where is the energy going to come from? And a lot of these medications deplete of B12, for example. So huge room for pharmacists to look into this and be helpful and be extra helpful for their patients. Organic acid testing also can open up your eyes to what's going on with someone's detoxification process. So I'm a big fan here too. Forget about stool testing. That's like for most of my clients, I would recommend it highly. And I discussed the adrenals already. Very important options for someone with fatigue and hormone imbalance. Anti-inflammatory foods, again, just a few minutes on that. That's one of those basics where we have to start. And if there are great supplements, we've done the right testing, and your client or patient is ready to do it all, to do the supplements and doing really well, improving, and still back to their original eating, fried foods, inflammatory foods, do not expect a tremendous transformation. I highly recommend to pick a right kind of nutritional plan, or the word is diet. I know diet is the word, but it doesn't sound good to most people. Diet means I have to do something, it's work. How about we work on nutritional plan for you and pick something that individualized based for you? That would be ideal. And I highly recommend plant-based days for people just to keep away from animal-based products for at least 1 or 2 times per week, to give your liver and your intestines and your gallbladder a little rest, if you can. That's ideal, especially again during this time of year. We see April when we want our body like, and no wonder, right? In religions we have different religions. We have the fasting, right now avoiding certain foods. It's all done for a reason at this time of the year. And from adrenals to metabolic health. So it's a natural next step. If you have adrenal fatigue, which again, the term is not recognized in traditional medicine, but let's say it's a low adrenal hormone output, that would be recognized. If it's there for long enough and it's a chronic problem, you could expect major metabolic health issues. And then the next step is, of course, the thyroid conditions. Between balancing hormones, looking into that HPA axis with adrenal fatigue and fixing that, energy comes back relatively quickly. And if you balance your blood sugar, it comes back relatively quickly. And when your client, patient, or you feel that difference, oh my goodness, I got my energy back, this is working, you feel more confident and you're willing and you want to continue. I know that worked for me. When I felt better, I realized that this was working. Of course, I wanted to continue and have this as my lifestyle. I never want to go back to feeling like I was. Gut-related issues are not just the stomach pain. It's not just diarrhea, it's not just constipation. It could be on top of your skin and something is screaming, I have leaky gut, something's going on. Or other things like redness on the skin, could be yeast overgrowth. Feeling constantly hungry, that's often an issue of some kind of gut microbiome being off balance. Probiotic supplements and herbs. Marina, that's still me. Okay. All right. I want to talk about functional medicine and functional solutions and quickly run into the case. I know that we have a limited amount of time, and I want to say a few things about functional medicine. I know the difference, and many of you know that the difference is to see conventional medicine as a great evidence-based, long researched, are somewhere we look into for long-term studies, but we do not really recognize chronic disease as well in that system. We look more after patching the symptom versus looking for the root cause of why this happened. Often that's the time constraints with the senior patient. Often that's because of the whole system is that way right now. But yeah, definitely going for an X-ray if you think your foot is broken, to the hospital and to the doctor. That's functional medicine is not going to help here. But for chronic conditions, hormone conditions, thyroid conditions, inflammatory conditions, look no further than functional medicine. That's where you have to start digging. 31-year-old Crohn's patient, that's the case study I want to discuss, running the Dutch test for adrenals and hormones, running GI map test, finding H. pylori, finding low output of adrenal hormones, changing the diet from something she thought she was doing really well with. She thought that, diet and healthy, she was buying all her foods in the health food store where she lived, health food store. So that was soy bars, that was really throwing her hormones off. The wheat cereals that were labeled clean and low sugar. She ate a lot of tofu, which wasn't organic, and that's a big difference. So she was high on and really estrogen dominant. Because of her nutrition, she thought she was eating really healthy. Fixing that was a major difference. Improving her, she was vomiting and nauseous because of the root cause of H. pylori that was somehow missed in her case. And she did an herbal protocol. She could have done the antibiotics. That's a choice. And she did discuss that with her doctor, as I always recommend. But she chose an herbal protocol which worked like a charm. It was a very different person 3 months later, and then 6 months later, it was a completely major transformation. And even her sleep improved because like she didn't realize how poorly her sleep was until she was better, and that improved as well. Then we did a little later for her the individual-based detoxification that made her a complete fan for life of functional medicine. And again, I didn't share the results of the actual functional diagnostics on here for the purposes of, we trying to conserve time here. But it was a happy mom. Her kid was thrilled. The mom was spending more time with the kids. So you can't put the price on that. You can't do that in a system that doesn't look after the root cause. It doesn't spend enough time, and that's, I think, we're here to transform. And it has to be done in the right sequence. If you go right away, sometimes after the pathogen like H. pylori and don't do the basics, don't look after the leaky gut or adrenals sometimes, it might not work as fast. It will still work. It just might not work as fast or as well. You might need to take longer. So picking and doing the right sequence is very important as well. Now Marina is going to talk to us about something extremely important.
Yeah, so again, starting with the basics, right? You know, Dr. Ina just walked us through the functional approach. And this is something that you might need to work with a practitioner, right? But the basics you can start doing for yourself and you could notice the improvement. And it might seem like, oh, this is so basic. I'm even going to skip this step because there's no way that it's making a difference. But I'll urge you, and this is where coaching can come in, with the proper support and systems and accountability in place. You can take the simple steps that are not easy, right? It sounds easy to do, but it's actually not easy to implement into your life. So starting with the foundational levels and the layers that we talked about with optimizing digestion really starts with eating hygiene. And from there, like I said, every other step of the way becomes better and easier for you to target with these other methods. So just focusing right on that cephalic digestion in the brain that I was talking about by smelling and seeing and salivating over this food. And back in the day, if you know, people used to prepare their meals. We didn't have fast food or any way to take out or to go to a restaurant. So this is part of the process where we would actually be the ones preparing our food, or somebody else that loves us would be preparing the food for us. And there's a lot to be said for that. And then the next part is just sitting and slowing down. And I really advocate for something like mindfulness and prayer. And Dr. Ina said something else about fasting that is so profound that I always think about too, that it is no wonder that religions and cultures are doing this in the springtime. And it is no wonder that people say grace before they have a meal. It's a way to, again, activate the parasympathetic, because it's the two balances that I was talking about. One is activate, go, 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 which our world prefers. And the other one is slow down, slow down. So we need to be the ones that balance that scale and tell for ourselves, when is it time to go? And when is it time, like Dr. Ina touched on too, to go home, you know, to stop your work and to go eat. And so just doing things like this, or breathing slower before your meal if prayer doesn't resonate with you or gratitude doesn't resonate, this will activate all of those digestive, parasympathetic, and vagus nerves that we were talking about. Well, there's just one vagal nerve. Chewing slowly, again, the mechanical grinding, and also making sure your food is there enough for the amylase and the enzymes to work. Eating until you're 80% full, right? Like in the blue zone diets you'll see around the world, a lot of them say you'll eat until you're 80% full, because your stomach actually needs that space to churn optimally as well. So you don't want to stuff it so it just sits there like a rock. So this again will just optimize the stomach acid. And then when your stomach acid is optimal, things like vitamin B12 absorption and microbiome harmony and defense against pathogens actually gets activated as well. So with the probiotics, right? So making sure your microbiome is diverse is the most health that you can help yourself with. So the more diverse your flora is, the more optimally you'll have things that regulate your, for example, estrogen, which we talked about, and other metabolism of other hormones and toxins, and also help you absorb the proper nutrients and keep potential pathogens in check. So we don't have just one species that's just opportunistic and just takes over the whole biome. So we want to have adequate soil-based or spore-forming probiotics, such as the Bacillus species. We also want, what I like is the Saccharomyces boulardii, which is a beneficial yeast species, which actually helps the diversity of other bacteria. And this is known under the brand name Florister for those of you pharmacists that are familiar with it. And it actually has studies showing that it keeps things like C. diff, Clostridium species in check. Then there is other butyrate forming, which is the beneficial fatty acids species that we want to encourage. And there's other supplements that you can take. Now there's a thing as postbiotics, which is actually just consuming the short chain fatty acids. But I really believe supporting the microbiome is going to be the best bang for your buck so that it can continue to produce those things for you. Now, from herbs and supplements, some of my favorite topics. So we want to select anti-inflammatory ones, and also we can use things to help our stress response and our adrenals and our microbiome and our defense against pathogens. So things like turmeric, skullcap, boswellia, ginger, L-glutamine, quercetin, and cerezymes, they help to clean up all like the debris and the inflammation and support the immune system and proper digestion and healing the gut lining that we were talking about. So where does herbalism fit? So I've made some graphics for you. I really see it as in the middle of food, using food as medicine and using a medication. It's really like that step in between that you can go and start to use your culinary spices and your herbs and teas and tinctures. And some people do use it in supplement form, but I really encourage it in their most bioavailable form as an herbalist to almost consider it part of your diet. So you don't probably want an herb when you need acute care, right? But you can make it part of your healthy lifestyle. So I want to just share a couple of studies before we go about such a simple herb that's so well known, probably to most of you, as chamomile. So we use the aerial parts, which means all the above parts, but especially the flowers. And it has phytochemicals such as chamazoline, A-bisabolol, matricin, apigenin, quercetin, and matricin. And you can see at least two of them, apigenin and quercetin, have been studied a lot in the literature. So it's considered as a generally safe herb, but there is a caution and a contraindication if you have an allergy to the Asteraceae family of plants. So 3 quick studies I want to share with you. So one is a long-term chamomile treatment for generalized anxiety disorder, which was a randomized clinical trial from 179 participants, which were selected for 12 weeks, and they had a crossover study design. So first they all took chamomile, and then they only half of them took chamomile continuously. So what they found is there was a non-significant reduction in relapse among responders to initial therapy. However, there was significantly better tolerance of symptoms for generalized anxiety and improved psychological well-being for everybody that tried the chamomile supplement. So the longer somebody was on the supplement, the less likely they were to relapse from back when they weren't on a supplement, is the main point. And also there is no side effects from such a treatment, which is another amazing thing. So the next study I want to share with you is another randomized double-blind placebo-controlled trial of oral chamomile extract for also generalized anxiety disorder. And why I chose these studies is, again, to show you that stress is so related to our bowels and connected to the inflammation that's going on. So these people that were treated for stress, the digestion potential of that is just amazing. And if you study herbalism, you'll see exactly why. It's that connection that I talked about with the gut-brain axis. So in this study, they were checking the HAM-A score during chamomile versus placebo, and they found a proportional dose response curve. So the more chamomile somebody was taking, which was standardized to the apigenin and titrated up, the better they rated on the scale. And then the last study I'll show is the connection to the digestive system directly. So this was a study about an apple pectin chamomile extract in children with acute unspecified diarrhea. And it was also a multi-center and double-blind parallel study, which is really cool, for kids aged 6 months to 6 years. And the study found that it did substantially reduce the duration of a diarrhea episode, with a median value of 36 hours in treatment group versus 45 hours in the control group. So they were able to demonstrate good clinical efficacy and tolerability of the chamomile pectin. And I also want to share with you a case study from my client. So it was a 30-year-old Caucasian female who came to me with dysmenorrhea, heartburn, indigestion, gas, bloating, constipation, diarrhea, and then other symptoms that are not seemingly digestive related. So it was headache, dry, itchy, flaky skin, anxiety, and bleeding gums. And so what we did with her, we gave her a main formula that has the Vitex berry and some other herbs to support her hormonal issues and this balance, which also was a little bit androgen dominant and a little bit estrogen dominant and progesterone insufficient. And we gave her herbal bitters before meals. So one aspect of chamomile is the quality of it is bitter. The taste is bitter. There's also a little bit of sweet in it. And so we gave her the bitters, which in Chinese medicine and other types of medicine, the flavor constitutes part of the therapeutic effect, which is why I mentioned that I don't prefer tablets and capsules if somebody's willing to take a tea or taste the actual medicine, because again, just like food, the herb is going to activate receptors on the tongue and tell your body what needs to happen downstream. So the bitters, which I honestly recommend to like everybody in my practice, is really meant to optimize every phase of the digestive system that we were talking about, and the peristalsis and the proper enzyme secretion and everything, and also the movement down and proper elimination, as we talked about. We also gave her on as needed basis an herbal cramp formula in the form of a tincture and a smoke blend because we wanted to help her wean off cigarettes. So the results were that within 10 days, due to the bitters, she had no heartburn. She was also doing an elimination diet too. She had cramps that were much more mild within about 2 months. She had less dryness and flaky skin, and her bowel movements improved now. And her elimination diet experience, she said, was eye-opening because it really showed her what foods she really was sensitive to when she tried to re-challenge and reintroduce them. And the other reason I wanted to bring up this case is because we know how inflammatory smoking is. So the herbals can help us to at least move into a less healthy habit. It's turn it into a little bit more healthy of a habit, because even though it's a bad habit, and even though it's still going to be inflammatory to smoke anything, I chose the herbs that would actually be soothing for her lungs and give her an anti-anxiety effect as well. So it was much more palatable and inclusive for her lifestyle to actually have that support with the herbs. So again, I'm sharing this, and Dr. Ina shared her case because we know it's hard. We've had to make changes and change our whole lifestyle in order to do what we do and in order to keep the health that we have been able to maintain for ourselves. So we understand that, you know, it's really hard to break out of the pattern that you may have been stuck in, or maybe you feel like you can't change, but you really, really can with the right tools and support and attitude. And that is what we do in our practice, is we figure out what's ticking for you and what is your preference, and how do we work with you to get you to do what needs to be done. And again, maybe if you don't want a tea, we're not going to go with a tea, right? And if you don't want to take a specific test, maybe we can avoid that test. And it's totally fine, but we want to get to meet you and sit down and talk about your goals and see if we're the right person or have the right tools to support you, so that you can start going out more, you can have more time with your family, you can be more productive and get to your goals. You don't have to like worry about going to the bathroom, or, you know, how embarrassing it is or how painful it is. So if you want to go fast, travel alone. If you want to go far, travel together. That's an African proverb. And again, it just speaks to how far you can go together with a coach or a practitioner. And again, we both work in a similar way, but we both just gave you a little bit of a different take on the same illness and diagnosis. So you see right away there's more than one way to heal. So it really depends on what you prioritize and what speaks to you, and the practitioner to help you will be able to meet you halfway with those tools.
And thank you, Marina. You got the main point, and you will be right at the goal. the next steps would be, if you're interested in my kind of work, is you could get any information on my website, digestivereset.com. You could get my best-selling books on there for free downloads. My signature line is on that website under shop. It's a basic protocol that is very helpful for those that not yet ready to do the program, but to start there and feel better already. And contact me through the website digestivereset.com if you want to have a talk.
Yeah, and if you're interested in working together with me or potentially exploring herbs, whether if you're looking for health support for your own issues, or if you're interested to learn from a practitioner standpoint how to have an herbal practice, I do have a mentorship. So just check out my work on my website. You can scan or take a picture of the QR code. It has all my links there. So my website, if you want to email me or book a free call just to see where you stand, we can make that happen.
And I think we have a minute or two for quick questions if those arrive. Do you guys have questions? Maureen, would you be able to unmute those if there is? I think there's something in the chat, right?
Yeah, I don't think I have control of the Zoom, so you can.
Okay, then I'm good. In the chat, I think that's you recommended.
Yeah, we were just talking about the filters earlier. So I put in what I personally use, and now I'm recommending is this borax filter, which is replacing, similar to the Berkey technology. If you guys heard about Big Berkey, but that's kind of going out of business because of some regulatory concerns.
Always that.
Yeah, it's about the definition that they didn't meet according to the EPA. But anyway, so these are a countertop filter that I use and have been using. They also, I think, are coming out with a line of shower filters and things like that, and drinking ware, but it's stainless steel and it has both fluoride and other types of filters available so that you can drink good quality water. Because one of the things we talked about is the toxins, and eliminating the toxins is so important. And water is just necessary, as you know, for life and for moving of your bowels as well. So we want to make sure we're hydrating ourselves, and in some cases also adding electrolytes back in. But I don't know what your stance is on different types of filter, but I prefer those that don't remove everything, but remove the harmful things.
Right.
And if needed,
minerals out.
Yeah. So I'm happy with it, and I think it's just easy because you don't have to install anything. But there's other filters that if you do want to install it in your actual tap water or your showers, you can do that too.
Awesome, thank you. And thank you for doing this today. And thank you guys for being here. Last call for questions. You could unmute yourselves if you'd like. You have that option.
I don't know if LinkedIn has any questions in there while we stream, because I don't have that open. But
let's see.
Yeah, if you have any questions or comments to share with us today, or any takeaways or anything that you learned that was new that you didn't know before, we would love to hear it. Otherwise, you can also comment after the event. I think the webinar will still be available, or shoot us an email.
Sounds good. Are both your practices exclusively GI related? No, not mine and not Marina's. I believe I'm answering for you. But I specialize in gut and hormone health, and 2 of my books were written on IBD and another one on hormone health. But I work with thyroid, with Hashimoto's, with autoimmune conditions. Yeah, we're multi-product. Yeah, thank you.
Yeah, I think for both of us, we chose like similar cases, and it's to showcase that nothing is just like one or another. Like even if you have a diagnosis and it is digestive system related, it doesn't mean other things aren't going on, and vice versa. If you come to us for something else, it doesn't mean we might not find something to do to help your gut. So people are complex and multifaceted, and according to, you know, the famous Hippocrates, all disease does start in the gut, and also healing can begin in the gut. So although I don't exclusively say I work with the gut, it is one of the things I specialize in. And most often than not, again, there will be some work on the gut, even if the diagnosis is not gut related. So I would say I specialize in gut and hormone. So specifically female, menstruating female hormone health. That's kind of my niche.
Great. And I'm very, very good with post menstruating women to get them back in the balance, because that's a difficult time. Have a lot of experience with that too. Okay, great. Thank you so much, everyone. If anyone on LinkedIn that's watching would like a recording, just comment recording. Marina and I are happy to share that with you.
Yeah, thank you everybody for coming, and hopefully you learned something and can share it with a friend or family member or somebody who may need some of this support and knowledge.
Thank you. Thank you.